the center and provide an overview. So our center was started by Dr. Robert Margolis Foundation, and him and his wife, Lisa, donated $16.5 million to us through their family foundation with the idea of starting a health policy research center here at Duke that also focuses heavily on creating future health policy leaders. And so we have both a research, an applied research mission, as well as an education mission. And part of that, we have, this supports our overall mission, which is where we want to improve health equity, and the value of healthcare through practical and innovative health policy solutions. But we also believe in taking an interdisciplinary approach. So for our vision, we actually, we want to make sure that we're bringing different disciplinary voices to our research and to our education to really make sure that we inform policy making and implementation for the betterment of health and healthcare with all the voices that we can bring to the table, different voices that we can bring to the table, because we found that it brings better solutions that are more sustainable. So today you're going to hear from 4 different people. We have Dave Anderson, who's a research associate. Who's been with Margolis for quite some time. Nizan Arad, and Nizan, I hope I pronounced your last name properly. I apologize if I did not. Who's one of our assistant research directors. Anna Bartz, who's an MBA candidate and Margolis scholar, and John Bolender, who is a policy analyst. So I'm going to turn it over to Dave to kick us off.
Good afternoon, and thank you for having me here. As Sarah said, I've been here for about 5 years now as a research associate, and my role has changed in the past year because I'm dual-hatted between research here at Margolis and a first-year PhD student over at the Duke Department of Population Health. As to how I got here, it was a non-traditional path. I was working in industry for a while and working at a health insurer, and found it absolutely fascinating as we were rolling up the ACA. I kept on writing, and then Duke recruited to bring me down. Since I've come down to Duke, I've been working a whole lot in payment reform and insurance design, so that we acknowledge the fact that payment drives what's possible. However, payment is also really confusing, so people make lots of mistakes, and trying to figure out how we can align payment to understandable and comprehensible information so that people can make good decisions is where my research has been going. So let me pass off to the next person.
Dave, can you give us a practical example of that?
Okay. One of the things I absolutely love, one of my favorite papers I wrote, was looking at this concept of what's known as a dominated plan, where there's 2 choices, A and B. On every choice, on everything that matters, plan A is always better than plan B. No one should choose plan B. Realistically, when we looked at California data in 2018, approximately 20% of the people who had the ability to choose either A or B chose B. It cost them about $500 more a year premium for a low-income population, and potentially an extra $2,000 a year in deductible and co-pays and co-insurance if they actually needed care. So we're using that to suggest to CMS, Center for Medicare and Medicaid Services, when people are placed into that situation, we can automatically change what they see and what they're placed into as the default, so that they make the good decision as the easy decision. So that's some of the work I'm working on right now.
No, that's perfect. Thank you so much. And I'm going to turn it over to Nizan, and I'm going to go ahead.
Thanks, Sarah. Hi, everyone. Good afternoon. Good to be here. I'm going to try and provide some examples from my work as well. So as Sarah mentioned, I'm an assistant research director on the biomedical innovation workstream at the center. And within that workstream, I work in a team that focuses on payment, pricing, and coverage for medical products and medical technologies. I joined Margolis over 3 years ago and initially started working on barriers to the implementation of value-based payment arrangements for medical products. So thinking about solutions to complex legislative and regulatory issues, including government price reporting, such as Medicaid best price, so that these arrangements can be better facilitated. And my work has expanded over time to include other areas, mostly in the drug pricing and payment space. I've been doing a lot of work on competition in the biologic drug space by looking at barriers to the adoption of biosimilars in the US, work that has touched on regulatory payment and other aspects, including lessons from other international markets. We're about to start a new and exciting project that will look at whether cell and gene therapies can be faced with biosimilar competition in the future when they lose their exclusivity. And I've also been doing a lot of work in the areas related to the new class of Alzheimer's disease therapies, thinking about the right Medicare coverage pathways and post-market evidence considerations for these drugs. And in terms of my background, I didn't really have the typical health policy Duke-Margolis background like a lot of my colleagues. I'm originally from Israel and got my law degree there, but I always knew that I was more interested in working in policy than in legal practice. And after graduating from Duke, from Duke's LLM program, I started working in DC on trade policy issues, including on pharmaceutical policy and intellectual property, as these topics relate to free trade agreements. And I knew that drug policy was where I wanted to continue my career. So after that, I joined Teva Pharmaceuticals, which is the largest manufacturer of generic drugs. I joined their public policy and government affairs practice to work on policy issues in international and emerging markets. Again, working on a host of issues related to trade and IP, including the treatment of pharmaceuticals in free trade agreements. I later expanded the scope of my work to US issues as well, mostly drug payment issues in Medicare and other government programs. And about 3 years ago, I joined Duke-Margolis. I will pass it on to the next person.
Yeah, thank you so much. And just so the participants know, we've got, once John and Anna kind of give us an overview of how they got here, we're going to open it up for a Q&A. So that way we have plenty of time to answer your questions. And then we'll end with a few more slides on just how you can get engaged with Duke-Margolis, either as a student or as someone who's interested in connecting with us. So I'm going to turn it over to Anna.
Awesome. Thanks for having me today. Happy Tuesday, everyone. I am an MBA MPP at Duke right now, so I'm about halfway through my 3-year stint. I'm originally from Minnesota, if anyone can hear my accent, or other Minnesota people on the call. But prior to Duke, I was working in the employer-sponsored benefits space, so more in a consulting capacity and helping employers figure out their total reward strategy. And I'm really grateful for that experience. I feel like I learned a lot about US healthcare. But I also learned how broken our systems are and how certain groups are more privileged just because they have access to fancy employer-sponsored benefits. So I think through that experience, which I'm really grateful for, it did motivate me to go back to school and, wanted to explore, how government insurance programs are working for Medicare and Medicaid and the uninsured, as well as how we can leverage private-public partnerships. For a quick minute, thought I was going to be an epidemiologist, but biostats is just really not my jam. But then I found the Duke-Margolis program, and to be honest, that's probably one of the biggest factors for me choosing to come to Duke. I was really excited about their interdisciplinary approach and just felt like there were so many experts in the field doing so many different things, both locally and nationwide and just globally as well. And I had access to them. So I was just really excited to join that community. And then I'll just highlight a couple of research projects I've worked on and happy to expand more and question and answer offline as well. But my first year here, I really wanted to work, within the COVID-19 space and try to just actually have impact and help local communities. So I was able to join a Basque Connections project, and we were helping a rural community, Pamlico County, North Carolina, and helping their health department think about how they could bolster their pandemic response, but then also thinking about how they could bolster their healthcare infrastructure in general. So that was a very rewarding project. I'm happy to dive deeper into that as well. That was kind of my first year, my big research I did. And then over the summer, I was able to intern with the Margola Center, which was a really great experience. And my project was working with federally qualified health centers, so FQHCs, And then for those of you that don't know, FQHC is their primary care community center, and they can provide care to anyone regardless of their ability to pay. So you have a lot of Medicaid uninsured patients going there. So this is my first time really, learning about this type of patient population. And then our project specifically was thinking about how could value-based payments be incorporated into their current reimbursement structure, and could that bolster equity? So that was a really great experience. I learned a lot. It was just a really good opportunity to increase those skills in applied research and work with mentors really closely. And then this year, I'm working on a project right now with Duke Hospital. Can't provide too many details on it right now, but it's been really rewarding to work with people in the health administration side and thinking about how they take these broader policy implications and actually implement them for the on-the-ground work to try to impact. So then next year, I have to do a master's project for my MP for my public policy degree, and I'm really excited to try to leverage some of Margola's expertise. Didn't mean to do a laundry list for y'all, but to bring it all back home, I think the great thing about Margolis is you have, as a student, you have access to these experts and to data and just to various mentorship and guidance. And that's really helped me both from a research perspective, but then also thinking about career. So happy to expand more on anything else. I'm also in the Margola Scholars Program and happy to answer questions about that as well in Q&A.
Yeah, thanks, Anna. And the graduate school application just opened for the Margola Scholars Program. So I will ask, I'm sure you're going to get a couple of questions a little bit later about that. So thank you so much for sharing. And so now let me turn it over to John, and then we'll turn to Q&A. John?
Hi, everyone. Like Sarah said, my name is John Bollinger, and I'm a policy analyst here at Margolis. Really what that means is I spend my time researching policy to generate written deliverables, so issue briefs, policy briefs, those kinds of things. I also spend time here working to put together convenings. So getting a lot of stakeholders together in the same room to discuss different policy topics. And more specifically, I spend my time here at Margolis working on the drug-resistant infections portfolio and COVID-19 response. So with the drug-resistant infections portfolio, I am working more specifically on diagnostics. So looking at the coverage, the reimbursement, and the use of diagnostics in the space. And then with COVID-19, I'm mainly working with the Global Accountability Platform, or COVID GAP. So it's an initiative across Duke University, so not just Margolis, along with COVID Collaborative and a couple of international partners as well. So that's the one where we're really bringing together a lot of global stakeholders like WHO, UNICEF, Rockefeller, Gates Foundation, Africa CDC, partners really kind of all across the world to generate and really disseminate a lot of policy proposals for COVID response. In terms of how I got to Margolis, this will probably be pretty brief since I'm a little bit early career. I've only been at Margolis for about a year now. So going into college, I thought that I wanted to be a doctor. I was like, you know what, I'm really interested in health. Let me major in biology, let me be pre-med. Early on in my career, I ended up taking a couple of global health courses as well. And I was like, you know what, this is really interesting. I'm really interested in the field of global health. Let me add it as a second major. So fast forwarding to junior, senior year of college, I'm kind of sitting there thinking, okay, med school applications kind of need to be now if I don't want to take a gap year, or I need to decide that I'm going to take a gap year. I ended up deciding hey, I want a gap year, actually multiple gap years. And I applied for the master's program in global health here at Duke. And while I was there, I got a cool opportunity to work kind of at the intersection between my two majors. So I worked on drug-resistant infections like I do now here at Margolis, and really used the opportunity during the grad program to also explore other areas that I hadn't necessarily done while in undergrad. The big one being health policy, obviously. I ended up applying for and doing the global policy program in Geneva, Switzerland. So that was a short course on global policy with Professor Gavin Yamey. And then we also had Dr. David Ridley there as well to give a talk. And they were really my first exposure to the Margola Center since they're core faculty members here. And then beyond the short course, I got the chance to intern at UNAIDS, which is really an exceptional opportunity. It was really the turning point for me. I got to work on the global LGBTI happiness, sex, and quality of life survey, which is a phenomenal project, like phenomenal people that I worked with. It was also really cool to be on it just because it was the first time that UNAIDS in its history collected primary data. And it was like they are collecting data to, synthesize and inform global policy. So it was really, really cool to be on that project, and it was really inspiring for me. And I was like, you know what, this is it. Like, this is the final kind of nail in the coffin for my MD aspirations. I was like, I don't want to do that anymore. I'm interested in going into health policy. So I ended up coming back from there. I finished the master's program right just after the waves of COVID started to hit the US in May of 2020, and then ended up getting the chance to work a little bit more with UNAIDS remotely for, I guess, a while. And then I ended up starting my job here as a policy analyst at Margolis in May of last year.
Hey, John, I can relate to all of the shifts and the multiple gap years and all of those things. And also my background is in global health. And so I completely identify and recognize with those twists and turns and those pivotal moments that make you kind of say, this is exactly where I need to be and where I need to be going.
Exactly,
thank you for your vulnerability and being willing to share that. I really appreciate it. Not everybody is willing to always be so honest. So thank you. I'm sure the folks on the call appreciate it. So now is our chance. So we just wanted to give you all a chance to get to know us a little bit. Now we'd love a chance to get to know you as for who've joined us, and whatever questions that you may have for our panelists or for myself. And also my colleague Gabby, who, if you give us a wave, Gabby, she is monitoring the chat, and she's going to also be moderating the Q&A for us as well. So I'm going to turn it over to her. Now it's time for your questions. I'd love to hear from you.
Thank you very much. I actually, to start us off, I actually have a question for David. David, you told us quite a bit about your work, but you have a very interesting career trajectory as well. You come from a completely different space, and then you kind of left academia for a little bit, and now you're back. Can you share a little bit of your path?
Yeah.
How you got from there to here?
It was a series of intriguing incidental accidents. I got my master's in public policy from Carnegie Mellon in 2003 and did a wide variety of work in Pittsburgh for about a decade. Got laid off during the Great Recession, and a health insurance company was hiring for people who were not scared of data. Knew nothing about health insurance, nothing at all. But I could run in Excel. I could deal with big data and not run away from it. So they hired me, which is always a good thing. So the summer of 2013, the Affordable Care Act is getting implemented. And anyone who has ever run code knows that when you're running a big analysis, if you sit around and you have coffee and just watch the machine run, it's going to be fine. But as soon as you walk away, it's going to blow up on you. So that was my entire summer. One of the blogs I was reading while I'm sitting around drinking coffee waiting for the code to run correctly was having a series of comments of, the ACA is coming, what does that mean to me? I knew the person who owned the blog. I was like, hey, this is what I do for a living. I can write from the insurance perspective. So I started writing under a pen name because I want to call my boss's boss an idiot without short conversations with HR. So I started writing about the ACA, and I started getting involved in a bunch of national level conversations as to how implementation works from the insurance perspective, because there's a bunch of perspectives from the patient, a bunch of perspectives from policy geeks and wonks, of which I'm one of them, but not from the insurance perspective. So I got involved in that conversation. Fast forward several years later, Duke recruited me when I was on the market, and they brought me back into academia as someone who it was a deep subject area expertise on the expert on the ACA, and I could actually use my own name. And that's been my past 5 years here.
Thank you.
And if you have questions, you can just take yourself off mute. And
Hello, everyone. Good morning. My name is Kenny Majalabi, and I'm a recent, I'll be joining Duke-Margolis starting in August. I apologize, I don't have my video on. My internet is very sketchy. So my question is around distinguishing between, and I apologize if this is a elementary question, the HSM program at Duke-Margolis and the Margola Center focus on healthcare and policy. Can you, if you're already attempting to engage with the HSM program, maybe can you spend a minute or two highlighting additional benefits and insights that the Margola Center would offer on top of that HSM experience? I appreciate your time. Thank you.
Yeah, I can. Do you want me to take that one, Sarah?
Yeah,
Okay.
I'll let you start and I'll follow it up if there's anything to add.
Yeah, so I am an HSM as a Fuqua student. So HSM is specific curriculum or an outside seminar class, if you will, and programming just specific to Fuqua. So you do get some health policy elements, but there is just review of everything within the healthcare system and trying to help students, figure out what type of careers they'd want. Where I'd say Margolis is bigger Duke and connects across various different colleges. So the public policy, School of Medicine. So that's how I view it. So there's definitely very different opportunities and happy to talk to you more offline, but maybe Sarah can fill in as well, similar details.
Yeah, Dave, you can jump in too if you know anything. So we do have core faculty who teach in the HSM program as well as, so I think there is a lot of interconnectivity that we can offer. In addition to that, like we're also looking into developing some executive education programming for students who are with the HSM folks. So there's just, in addition to our research, we also have these different education initiatives. We're launching a new class, which is actually taught by one of our staff members. So not only do we kind of approach it from like a faculty is engaged with us, but then we also offer our staff to teach classes as well to kind of promote all of the interconnectivity as well with the HSM. So that kind of leads to the ability for us to have some additional research projects that we after with those, faculty and staff that are working to kind of together with those students. So it's a bit of triangulation. We have academics, we have research, and we have some additional programming like the Scholars Program as well.
Sure. That's great. I think what I'm hearing is Margolis actually has some intersections beyond what Fuqua HSM can offer. And also some experiential learning opportunities from a policy. If I could follow up with another question, I apologize. I'll stop talking
Please
after
go
this.
ahead.
So from a research standpoint, there's I'm curious to see how whether scholars are working independently, if there's a group of people, kind of how the research is set up and the scope. Can you, as a scholar, come in with a question you would like to explore, or does the center kind of provide you with some unanswered questions that they would like you to focus in as a scholar? I appreciate your time. Thanks.
I can share the formalities, and then Anna, you can share your experience. Does that sound good? Okay, so it can be a both and. So we have kind of if you apply to be a Margolis scholar, we have a specific curriculum where we explore topics with you, not necessarily for research purposes, but to make sure that you have foundational knowledge that, to kind of help you to develop your own research questions. So you can, to kind of help you guide your own independent research, or if we have faculty and staff who are doing interesting related work to what you're interested in, we can connect you with them so you could jump on to a research project. So it's a little bit multifaceted. And it depends on how you come in, but we do have kind of opportunities for all of the pathways that you outlined. But Anna, can you maybe share a little bit about your experience? Because you've actually taken advantage of, I think, every pathway that we have available.
Yeah, I think it really just depends on, like Sarah said, what pathway you're doing. So for vast connections, for example, you'll have research investigators that propose a question, if you will, or a project, and then you apply to be on it. But then there are also independent research opportunities. It's certainly easier to jump onto something that the faculty is already doing, or thinking to like what type of data you want and have access to. Maybe you do a little side project for them. I'd say from like the business school perspective, there isn't necessarily like a master's project or a thesis you need to do. So you really have room to be creative and explore different options.
Thank you.
Yeah, thanks, Anna. Okay, other questions? You can take yourself off mute and just start chatting, drop something in the chat.
I have something for John. John, you mentioned that you were in the Geneva program, and that is a super exciting program. Can you share a little bit about that? What it is you do, how long it is, what your connections were that you made there?
Yeah, absolutely. So the Geneva program, it's open to undergrads and grad students, not just at Duke, but just like kind of wherever you can apply to the program. And if I'm remembering correctly, there are a couple different tracks. I know one is like environmental, but the one that obviously sticks out to me is global health because it's the one that I did. You end up applying for the program, and really what it is, you're applying for like the course that's in Geneva. And then you can decide if you want to just come for the course or if you also want to intern. And then if you decide that you also want to spend the summer interning with one of the multilateral organizations in Geneva, they'll help facilitate your application process for those different organizations. So usually we have like a listing of the different internships that are available, and you can kind of pick and like tailor which ones you're most interested in. And of course, there's a lot of supports that'll help you out with that a lot. It was absolutely one of the most inspiring programs that I've done. Like you get to see the inner workings of all these different organizations. Like Professor Gavin Yamey has like all of these amazing connections with like for me, it was the Assistant Director General of the AMR program, specifically because it was related to what I was doing at the WHO. Dr. Hannon Bulkey, she came to speak during one of our sessions one week. And then oddly enough, the way that my organization was set up, UNAIDS and WHO actually share a lunchroom. So it's like kind of you're just like in the lunchroom with like Director General Tedros, so just like come in and eat lunch sometimes too. So it was like very cool to like be around all these like very high level individuals. Part of the course as well was like a lot of site visits with like MSF and UNICEF and UNAIDS and those different ones. So you got to hear how the different organizations work together and also like independently of one another. And yeah, the internship is like it was my personal, like the course was great, but like the internship was like a lot of hands-on experience where you get to work with experts in the field at this level and like really see what it looks like to work on global policy problems.
And how does that translate into the work you're doing at Margolis? Are there linkages? Are there ways that Margolis is now maybe building on that experience, or what did you take forward?
Yeah, absolutely. The thing is with like AMR is that it's such like an inherently, or drug-resistant infections, like inherently a global problem. So I know a lot of like Duke-Margolis, a lot of our work is domestic, but just like the nature of that project and the COVID gap, the global accountability platform that I'm working on is also a global initiative. So even though Margolis as a whole is usually a little bit more positioned for the domestic work, I am very fortunate to have like the international connections where we're working with the similar stakeholders that I had in Geneva. Like one of our convenings with the COVID gap project, we had the WHO and UNICEF, like both of them were co-conveners for it. So it was very beneficial to me to already have experience working with these people and be able to interact with them and like know how best to proceed with like organizing and convening with them and how to get their buy-in for these different things and get them to help us push forward policy. So I think even without that, even if I was just working on domestic things as well, it's helpful to know how to engage with high-level stakeholders and how to produce written deliverables in a way that gets to the target audience and is understandable to anyone who's reading it.
Great, thank you. Shamar, you have your hand up.
Yeah, of course. I first just want to say thank you all for sharing your experiences. And I'm a sophomore at UNC studying health policy and management. And I'm going to be an incoming summer intern for the Margola Center. And so I have a question for each of you. Just, it's a pretty broad question, but where do you see yourselves within the next 2 to 3 years, whether that be still with the Margola Center or Onward?
I think that's a wonderful question. I have the easy answer. 3 years from now, I'll be hopefully defending my PhD dissertation. And that means I'll still be here at Margolis. And then I'll be looking to see what my next big step is. I don't know what that is in 3 years because that's too far away to think about from a doctoral program point of view.
And I'll just have the same answer minus the education part of the doctorate that Dave is pursuing. So I still see myself at Margolis deepening my research and my understanding of the various complex issues that we're grappling with here at Margolis.
Just like, yeah, it's like, Anna, do you want to go next, or a game of like chicken? For me, since I am like super early career, I've been at Margolis for about a year. I think I don't have plans to leave Margolis. I do feel like there's a lot left for me to learn here. But I will say that I have been considering additional school after this, particularly law school, just to get on that side of things. So it's actually interesting here that Nitsan has that background, because I actually didn't know that. So I'll probably be talking to her about that. But even if I did decide to go back, I would probably opt to stay at Margolis and like work part-time.
Great, thanks.
Yeah, and I'll just share my plans thus far. So this summer, I'm upcoming summer, I'm interning at Boston Consulting Group. So hoping to work in more public sector health pol work, but we'll see. And the plan as of right now is to work thereafter. I guess in the 3 to 4 years, I might be hitting my 2-year marks, maybe reevaluating. I think long-term, I'd love to get more back into the public side, but we'll be doing consulting for the short term.
Yeah, thanks.
Yeah, perfect. Thank you for answering those questions. And I'd just like to say as a side, I think the chat may be disabled. I don't know if that's just for me, but thank you so much for answering my question.
Okay, great. Thank you for letting us know about that. Kahindi?
Yeah, I'm already breaking my promise of not talking again. But I have 2 questions. Again, primarily viewed from the MBA lens. With the additional Margolis experience, I'm trying to like calibrate on like, if you, and maybe this question is directed to Anna since she has the MBA experience, like how much additional time are you spending to kind of really engage in a meaningful way with Margolis on top of your MBA? And also for the rest of the panelists, I'm just curious to maybe understand like a key takeaway from the Margolis experience, like maybe one key insight that you picked up as you engage in your research, as you engage with people from other aspects of Duke, like something you had never maybe thought of before, but then by participating in Margolis, kind of the light bulb moment kind of went on for you. I appreciate your time. Cheers.
I can go first, just kind of the time commitment question. And I think this could be for students in any program, because I think students in general feel very busy. And it's always a question of like where you want to put your time. And I think the great thing about Margolis is they have just like with a scholars program, at least just like weekly events that you can attend and participate with. But they're, for at least for me, it's like the fun part of my week. I think the Margolis community is a really great group of people, and it's really nice to spend time with people that are like-minded and also passionate about health policy. So I think, yeah, it's especially like, I will tell you, like, if you go first year business school, it's very busy. I think fall for any program is, so you just have to figure out how much time you want to carve out of it. And really, I think you enjoy the program more when you're more engaged.
Yeah, and I'll say that, for all of our programs, we have even if you're not a Margola scholar, we do have weekly events that are public to both Duke students and to Duke and non-Duke students. So there are lots of different ways to engage. We also have formal classes that you can choose to take. We have the summer internship program, which is a 10-week intensive piece that you can do where you're directly partnered with a mentor to do a specific research project. What we try to do is match you based on your interest, not just the mentor's interest. So we found that about 30 to 35% of our interns each year continue on working beyond the summer with our faculty and staff. And many go on to publish or present at conferences and things like that. So we have time for one more question, and then we can spend a few more minutes talking about ways to engage with the Margola Center, both as Duke and non-Duke students. So you can take any additional questions from either the chat or just take yourself off mute.
Hi, I'm an incoming graduate student, the Bioethics and Science Policy program. And I have kind of a question, and then just I wanted to hear more about one of y'all's experiences. So as far as the Duke-Margolis Scholars Program goes, I looked through the faculty list and I don't see anyone that is of my particular, whose research is in line with my particular interests. Is that a necessary part of the program, or can we have like a more independent sort of project or set of interests than is laid out there?
You can have a more independent set. So what we try to do is if we find that you're interested in something, we may ask our community for connections to find you a better mentor in the health policy space related to that topic. So somebody who's working at the intersection, but it's not necessary to come in. And I think what we would just say is that in your application, it's always good for us to know that you've done the due diligence and maybe recommend somebody who, for maybe another department that you think would be a good fit. Because oftentimes what we'll do is we'll approach that particular mentor and ask them to become core or affiliated faculty so they can mentor you. Because we don't want to pretend that we know everybody. We try to know everybody who's working at the intersection of health policy here at Duke, but it's a pretty big school. So, and it happens a lot where we get new mentors that way and new faculty. So we welcome a broadened approach and we'll kind of customize some things to you once you get here.
Great, thank you. And then really quickly, I kind of just wanted to ask about John's experience working in LGBT health policy. That's an interest of mine. And so when you mentioned that, I thought it was, I might ask about it.
Go ahead.
Yeah, absolutely. So yeah, that was the work that I did at UNAIDS. They were interested in launching a survey on general, more holistic indicators than had been done before. So like I said, it was on just measuring happiness, sex, and quality of life. And it was meant to be representative from ideally every country in the world. Obviously, we ran into a lot of barriers with that just because it's criminal in some countries and it's obviously discriminated against in pretty much every other country. So it was a very interesting project to be part of, and something that I think is ongoing with UNAIDS. I'm no longer working directly with them on the nitty-gritty of it anymore. I know the last thing that I heard is that we were working to put out the publication from the results of that first survey, and they were looking to make it a more routine survey. But it was, for me, again, it hits obviously very close to home for me. So I was very interested in the topic, just on a personal level, and wanted to engage with that from the perspective of getting evidence to support policy for people who traditionally are underserved or just ignored in the health policy arena at national and global levels. It was overall a meaningful project for me, something that I would like to be engaged with still. I'm still in contact with the people who are running the project. And of course, always looking for opportunities like as I move forward to work in that area again.
Great. That's great. Thank you so much.
Yeah, thank you.
And I'm happy to say more if you ever want to email me with other questions.
Wonderful. Thanks, John. Okay, I'm gonna turn it over. I think we could actually, we have time for one more question, or I could turn it over to Gabby. So any more final big questions for our panelists? Okay, I'm going to turn it over to Gabby, who's going to talk us through some ways that you can engage with the center, and then we'll go from there. Gabby?
Yep, thank you. Give me a minute to share the correct screen. All right. There we go. All right. So how to engage with Duke-Margolis. We have several ways that you can get engaged, and I can tell you a little bit more about that. We have the Margolis Scholars Program that was mentioned a couple times already. It's a prestigious program for Duke students that have a strong interest and a commitment to a career in health policy and management, and as well as students who see themselves in the leadership position in their career paths to improve health policy. The Scholars Program provides students with skills, knowledge, and abilities to continue their paths into the health policy sphere. And the program has 4 components. One is the knowledge building. And then that encompasses courses, our seminars, and then workshops. Then we have the skills enhancement and training. We have skills labs, TA-ships are available. You also have the chance of planning policy events. And then we have a peer mentorship programming that's available for the scholars. Professional development, you have one-on-one mentorship and advising. Again, the opportunity to attend conferences. You can apply for and receive internships, fellowships, guidance and placement. So how do I write a successful application? And then community service events are also, if that's something you would like to do that. And then, of course, you have the opportunity to do community building and networking, which is also something that's really important, as you all know, to just get connected with people. And the Margola Center, as our panelists said, is very welcoming and gives you many opportunities to connect with established professionals in the health policy realm. All right, what does the application look like? So it's open to graduates and undergraduate students. We have an online application form. We need transcripts. We would like a resume, and then we need a reference. You can find more information at healthpolicy.duke.edu/scholars. Right now, the application period for graduate students is open. So if you are interested as a graduate and professional student, if you're interested in participating in the Margolis Scholars Program, the application period is open till the 4th, May 4th. So opened yesterday till the 4th. And then we will do interviews mid-May, and then the decision notifications come sometime in, May 25th. For undergraduates, the scholars applications are now closed, but the dates for the next cycle will be announced later.
It typically opens in October. Yeah, for juniors only.
Juniors. Then we have, okay, there you go. The internship. We have a summer internship program that's 10 weeks. It's a paid internship opportunity. It's for undergraduate and graduate and professional students, and it is open to Duke and non-Duke students. And you are, you will again be developing your own work. You'll be doing your own work. Your deliverables are a research poster presentation, an oral presentation, a TED Talk or a panel presentation. So that gives you visibility to a larger public, and it also helps you present on your presentation skills. So just a very practical experience. You will be doing qualitative or quantitative research, and there will be there's support for presentation skills, writing skills, improving your research skills. The focus areas are healthcare transformation, biomedical innovation, global health, and education. And then again, being part of the Margola Center just opens up many opportunities to connect with established professionals and with different stakeholders in the health policy field. To apply, location TBA, that can be on Duke's campus. Given the past couple of years, there's also been the remote opportunity to participate in the internship. It's open to undergraduate and graduate and professional students, and as I said, Duke and non-Duke students.
This year we're operating in DC and in the Durham office. Okay.
And application materials, again, a resume, transcripts, and then an academic writing sample, and then one reference, and then we have a short questionnaire for you to fill out. For this summer, we still have select opportunities available. So if you are interested in working in health policy, gaining experience, gaining practical experience, as well as research experience, honing your skills in a way that will be useful for your future, please get in touch with Tiffany Chan, tiffany.chan@duke.edu, and she'll be happy to give you an overview of the opportunities that we have available for this summer. Okay, then we have the BAS Connections program. That is a Duke program that allows students to work directly with faculty on a project, on a very hands-on project. The upcoming projects for the next academic year are, one is centering pregnancy. So that is working with the constituency of women experiencing pregnancy, and working also within the Duke Hospital, doing research, hands-on research. We also have a project on health disparity and outcomes for patients with hypertension. Then a very interesting project mingling faith-based needs and patients with cancer. So going at it from a completely different angle. Then the very, very big project that also Dave has in his portfolio is financial burden, and how does that affect patients that have health disparities. And then another interesting project is focused in North Carolina, and it focuses on mental health services for Latinx children. Application period for this upcoming year is now closed, but for the next academic cycle, they always open in January.
The official one is closed. They're going to open one in the summer for those incoming Duke students. So it is closed for Duke students, but if you're going to be newly accepted, they will open sometime in late June, early July. And sorry, Gabby, I forgot to tell you that.
Nope. Good to know. Again, application materials, basic background, a resume, 2 references. One has to be a faculty member, unless you're a first-year student, in which case you probably don't have a faculty, not that much connection to faculty yet. And then short answer questions for your rationale for participating. Now, we also have, looking ahead onto your future careers, we do have a postdoctoral program. It's a 2-year opportunity for health policy professionals after they complete their PhD. And there are 4 research areas: biomedical innovation, digital health, health equity and anti-racism, and healthcare transformation. And we are right now actively recruiting for or interviewing actually candidates for our upcoming cycle. The cycle starts in July, and then, as I said, it's 24 months. So we will have a new cohort coming in this July. So once you're a little bit further down the line in your education and have your PhD, that is a great opportunity to just delve right into your field, into the field of health policy, and really work with experts in the field right there at the center. And one of our panelists mentioned the seminars. Yes, they're bi-weekly, alternate Fridays from 12 to 1:30 on Zoom. At the moment, they are restricted to members of the Duke community, but do join our listserv, and you can receive an invite to that. They're super interesting. We have researchers, established faculty members presenting on their research. We have junior researchers presenting. We have works in progress presentations by teams. Our scholars have talked about their projects just last week's seminar, and our interns have talked about their projects. We also had our Bass Connection students present there. So it's a really great opportunity to, again, showcase your work to a larger audience, and at the same time also hear from established and researchers what they do. The next one will be April 29th. Again, if you are not within the Duke community yet, please use this website and to sign up. Then we have our student group, the Student Collaborative on Health Policy, and they focus very much on campus engagement, on career and professional development, health policy education, and service and advocacy. And this student group is a very, very engaged and dedicated group of young people at Duke who are very much interested in continuing their careers in health policy. And that is a peer mentoring to a large degree. It is really, students put courses on the list. So there are 3 house courses coming up in the fall that are student run, that do have faculty oversight, but they're basically collaborative courses that are, within the student community, so that you as a student have an opportunity to really contribute and work with peers and gain from their experience. So the faculty advisor is Janet Betker, and then we have the co-presidents for Zavira Bazrai and Josie Lee. They will be happy to answer any questions. Feel free to email them, follow them on Instagram, check out their website. There's Twitter, there's Facebook, whatever you like to use. And then at the end, thank you very much. It's been wonderful to have you here. Thank you so much to our panelists. It was really great to hear about your experiences, your career paths, your twists and turns. It's always very comforting to hear that people don't always have a linear path. So please do follow us. Again, we have a Facebook, we have a Twitter, we have Instagram, and we also have a YouTube channel with student voices. This session has been recorded and it will be uploaded onto that YouTube channel. So if you've missed it, or if you would like your friends, colleagues to see it, please forward that. Our monthly newsletter, Duke-Margolis at duke.edu. If you feel like calling us, you can do so. If you feel like visiting, we are in the JB Duke Hotel. So I think,
thank you all. And we're Gabby and I will hang back in case there's a few more questions. Again, thank you to our panelists, but hope you all have a great afternoon.
Thank you, everyone.
yeah,
Have a good afternoon, all.
thank you. Okay.
Liz or Celia, can we answer any questions for you?
I got all my questions answered, but thank you so much. Have a good one.
Thank you.
Thanks, you too. Have a good week.
Bye.
Bye.
Is that our Luke?
I do believe it's our Luke.